Welcome to Gravity Talks.
Hello.
I am your host, Vicki Yelverton, the proud CEO of Yelverton's Enrichment Services, where we've been providing mental health supports and physical health supports to the community for over 15 years. And I'm excited to be back in 2021 right here on Gravity Talks.
All right. I am Natasha Lewis, pastor of Temple of Deliverance Church, also mental health worker, just ready for 2021. I'm glad 2020 is over. Gravity Talks, y'all, we back and we are ready.
Woohoo! So, without further ado, y'all know the drill. We have some awesome guests joining us tonight. Yes, we're going to be talking about mental health and the vaccine. So, without further ado, we're going to go ahead and let our guests introduce themselves. Let's see, Miss Kim. We'll start with you. Tell the people a little bit about who you are and what you do.
Hi, everyone. First of all, ladies, I would like to thank you all for having me back. Happy New Year. I am a family nurse practitioner. Currently, I practice in occupational health, and I also work in the urgent care setting. I went to college with Vicki, ECU, and I have gone to UNC Charlotte also. So I want to shout those two schools out. And also Lenore Community College, where I first started my nursing degree. So thank you.
Awesome. Thank you, Kim. Welcome back. All right, let's go over to Nurse Chelsea. Chelsea, tell the people a little bit about who you are and what you do.
All right, my name is Chelsea Smith. I am a MSN RN. I'm a board certified psychiatric mental health nurse. I currently work in utilization management, and I also work part-time as a psych nurse in a private hospital in the admissions department.
Wow, welcome, Nurse Chelsea. So let me see, utilization management. Tell us a little bit more about that.
I pretty much record reviews when you're admitted to the hospital. I'm the one that goes through your medical records, making sure that the doctors are doing what they're supposed to do, and communicating with the insurance company so we can get your claims paid for. Okay. Or if you can't get them paid for, then that's when the doctor usually says, okay, it's time for you to go. Your insurance is pay. So that's pretty much how it goes.
Okay, well, that's the truth.
And I'm going to ask about that later, right?
All right.
I'm going to ask right now. It's coming.
I got you.
Thank you, Nurse Chelsea. Thank you. Let's see, Nurse Haskins, how you doing? Welcome to Gravity Talk.
I'm good. Thank you for having me.
Yeah.
I'm Nurse Haskins. I am actually sister friends with Chelsea. So thank you, Chelsea, for recommending that I be here. Thank you, ladies, for allowing me to share this platform with you. I'm a board certified family nurse practitioner, and Chelsea and I went to school together at Durham Tech. So big ups to Durham Tech, and also we went to school together at Winston-Salem State. So big ups to Winston-Salem State. I'm now in Atlanta practicing medicine. I recently became a full-time entrepreneur who works in family medicine. So I will prayerfully be opening up my own independent practice in March of this year. So primarily focused on chronic medicine, health prevention and medicine, and excited about just providing services to the underserved communities of Atlanta.
Awesome. Okay, so we got an awesome panel here.
This Chuck some pearls right here, big. We got Chuck some
Yes,
pearls.
'cause the
That's
people
all I
wanna
see right
know.
there.
They want to know about this topic, so I feel so good to know we got the great minds here joining us tonight that's gonna share. All
Yeah,
right, so we're gonna
They
jump
real
right
smart.
in. You said what, Natasha?
So they real smart. Everybody.
They're very smart. All them in school and about to open businesses and stuff. That's
They
what I'm
got lots of letters. They got letters behind their
a
name.
whole bunch of letters. But they put a whole bunch of time and effort. So thank y'all,
Most
ladies.
definitely.
Congratulations. I salute y'all. I salute y'all. So the purpose of Gravity Talks is to destigmatize mental health. That's the main premise behind Gravity Talks, but also to bring in all aspects of life, whether it be mental health in the church, whether it be mental health in divorce, whether it be mental health in the vaccine. And like Kim was on our last show, it was mental health and essential workers. And so tonight, again, we want to jump on this topic about the vaccine. It's been buzzword. I mean, before it was COVID, and COVID is still a buzzword, but then now the vaccine is the new buzzword. So again, we want to kind of show the relationship between mental health and the anxiety, I guess, associated with the whole situation about the vaccine, and also what you all have been kind of going through in life, just with your own personal lives and your professional lives. So the first question I have is, share a little bit about your connection to mental health, whether it be personal or whether it be professional. So let's see. I'll start with Nurse Haskins.
I was waiting because I'm the piggyback queen. I piggybacks. Thank you so much for that. Mental health is just such a delicate subject for me. As someone who's been in, a licensed nurse for 20 years, and I always used to pick with Chelsea and go, yeah, that mental health is for you. That's your area of expertise, because we all have our gifts of operating our gifts, and she's always been someone who I've been looking up to, working in mental health. So as far as me and working in COVID cases, I just actually got home last night. I flew in from Texas last night, and working in COVID crisis cases out in McAllen, Texas, about 30 minutes from the border. And I think that for me, it was a transition, or it was a transformation of my mindset. And I think that as healthcare workers, with me working in the capacity of an ICU unit directly with COVID patients and seeing them lie there on ventilators and things like that, it was a shift for me. It was very challenging for me to put myself in the place of the patient and the family, and not being able to have that contact. And it was just very challenging. So I would say working with patients in the past, unless you work directly with them, you never really understand the impact of what it can cause on the patient, the family, as well as the healthcare worker. I think that as healthcare workers, we tend to leave ourselves out of the equation, and the effect that it causes on us. So I would say, for me, for someone who's never worked directly in the mental health, I've always done med surg and home health and all those things, or areas that I've considered to be the safe area, right? But not specifically work in psych. But I think that for me, working in the capacity of taking care of COVID patients, I could see why all that is important, and it should be integrated together for first-line healthcare workers. So it's definitely a very, very delicate subject, in an area that needs to be visited more. So hats off to those of you guys who work directly with it.
Wow. Well, I mean, you kind of described what I think the media has portrayed and was transparent about, showing all the patients that have been coming in through the ER or the ED. They've been put on ventilators, not able, loved ones that have been transitioning on, not getting a chance to see their families. And you all have been exposed to seeing that firsthand, So like you said, as far as the aspect of the mental health side for the patients, how has that really impacted your own health, Nurse Haskins?
Okay, so for me, I really, on the flight back, I said to myself, I'm going to sleep, but I couldn't. I started to just journal my thoughts, and journal, like reaching out to my family, because I don't think that people get it, and again, I'm not an ICU nurse, but I worked in an ICU in Texas when I was there. So it's kind of like you're in a COVID crisis, you're on this assignment, so you go where you're needed. And just having family members be called on iPads, hiding the ventilation machines from them, but letting them see their loved ones. I put myself in the mind, because I'll tell you guys in a transparent / HIPAA type of example. There was a daughter who was called because her father was still alert and oriented. However, he was asking to remove the tube, and they called his daughter to say, your dad is tired. He wants to remove the tube. And she's like, no, let me see him. Let me talk to him, because he promised me he would fight through this.
Wow.
And I stood there just looking at this iPad that she was on. And then the doctor came, and respiratory was there, and everyone was there just trying to tell her, your dad is tired. Like, he's given up, like his breath. He can't really, And she actually drove to the parking lot of the hospital and was asking and begging to come inside just to tell him to fight. And I put myself in her shoes, guys. And then Chelsea know I'm a crybaby. So I just said to myself, if that was my dad, like, I would want to, I don't know how I would deal with that. So I had to take off my, my scrubs and just put myself in the face. What if that was my dad and they were calling me on an iPad?
Wow.
To see him and tell him, just telling me your dad is tired. He, and I'm saying, no, let me see him. That's what she wanted, and they wouldn't let her in. And I'm just thinking, my gosh, like, how many other families are going through something like this? I don't know that every institution uses an iPad to call the family when the patient is beginning to transition. But this is what I witnessed. And I was taken, and I don't think I slept. And I was just, I was prayerful for the family. And I'm just like, I had to ask myself, as I do in all these years of being in healthcare, what if that was my dad? What if that was, so it took a toll. It really did. I had to do some, a little shifting, little mind shifting and meditating and things like that to get me back in the soul of just, okay, this is what we do. This is who I am. Get up the next day and go to the next shift.
Wow. Thank you for sharing, Nurse Haskins. I know that it's been tough, and I'm sure I see Miss Chelsea, is that the way? Kim nodding her head. Chelsea, share a little bit about your connection with mental health. I mean, you have the certification, so tell us a little bit.
Yes, and so I work part-time at a private hospital in Raleigh, and the thing about it is the patients that are coming in, there are school teachers, they are high school students, there are college students that are coming into our facilities because of anxiety. I had a patient this past weekend that had high anxiety, suicidal. Mom had passed away. Mom passed away 2 months ago. Sister passed away last week, and just coming in and, I don't have anything to live for, and just sitting here, I'm getting chills because when I was talking to them and, triaging them, I'm just like, this is real, and people are not taking it as serious. COVID is, like Elise said, is affecting the nurses, it's affecting the doctors, it's affecting the CNAs, it's affecting a lot of people, healthcare, but it's also affecting our community. And so when people our patients are coming in, I'm having to look at them like, okay, it's COVID, their anxiety is up, they're feeling like they're having cabin fever, they can't go anywhere, they can't do anything. And so, it's hard sometimes in trying to settle them and settle their minds and just say, you can't say it's going to be okay, because you don't know what the outcome is going to be. So you do a lot of talk therapy with them, kind of be there with them in the moment, and kind of be open and not and outside the box, in a sense, and allowing them to feed what's going on with them, because a lot of times you come in and you just want to rush, or if it's a patient that we've had over and over again, and you're thinking, okay, they're coming in for the same thing, but when they come in, it's like there's something different, so you treat them so what's going on with them right now. And so sometimes that's hard, and it's just been a real challenge, especially our census has been up, because we're having more patients coming in due to having suicidal ideations and not feeling like anymore. And a lot of it has been due to COVID and losing loved ones. So, and it's as me, personally, so when COVID first started, my mom was hospitalized in Atlanta, and she already has respiratory issues as is. And so, it kind of stressed me out because I only was able to talk to her. My sister was videoing her on the phone. Her O2 saturations were dropping. I'm texting Elise, like, what do I need to say? What do I need to do? Because I can't get there. And then they weren't really allowing anybody in. By the grace of God, they let my sister in. They wouldn't let my sister ride the ambulance with my mom to the hospital. So all of that kind of, that's when COVID is real. Okay. Mm-hmm. Real. And there's nothing to play with. I could have easily lost my mom, in that action. She said she was in ICU. So, it's just been a challenge in reality. So, and you have to see it for what it is, and you really can't play with it. So,
and see, like your vantage point is kind of a double-edged sword because you work for the private mental health hospital. You also work on the physical side of things as well. And so, like you said, you got folks that already are dealing with mental wellness concerns aside from COVID. And then you have folks that are dealing with mental health concerns in result of COVID, so it's a lot to juggle. And then meanwhile, which, again, we'll ask that question in a little bit, but, you got to look out for you because you ain't no good to nobody else if you're not good yourself, So thanks for sharing that, Nurse Chelsea. Kim. Hey,
ladies. So when I think about mental health, soon as you step outside of your door, you have to think about mental health. Every contact that you have with anybody, even people in your own household, you're dealing with mental health. For me, as a provider, I always have to consider someone's mental health when I'm dealing with their physical health. They go hand in hand. If you're physically sick, we have to look at the whole picture. Sometimes some of your physical ailments could be a direct result of your mental ailments. Another thing that I try to make sure that I do, especially for African American patients, is, really ask them, hey, what's going on? Our culture, we don't like to tell what's going on. We don't like to, what we call, show weakness. So I will ask questions and make sure everything is okay as I'm pulling up the computer or going through their chart. I try to have a lot of small talk. Sometimes people just want to have a few minutes to vent to somebody, that won't judge them. So I'm always thinking about mental health, especially since the pandemic has occurred, because it has been tough for me. So I know that it's tough for my patients. So I really try to get people to open up, and you have to establish trust in those first few minutes. So you just have to talk, and some people won't talk, but some people will. And some people just don't know what alternatives they have, what options they have, what resources they have. So, I may be seeing you for a strep throat and end up saying, hey, here's a therapist you can go see, and it's okay to do that. So I'm always thinking about mental health. We can create some physical ailments if we're having some tough times with our mental health. So always thinking about mental health.
And thank you for sharing that, because I think it's been a while, but for such a time as this, that mental health and physical health are coexisting. I think for a long time they ran parallel. And I think it was because of the stigma. I think it was because of the lack of education and awareness. And, people were so busy putting it off on somebody else. Ain't nothing wrong with me. Ain't nothing wrong with me. You see a therapist. I don't need a therapist. Whereas now there's been a lot of transparency, especially amidst the pandemic, that has put everybody in a vulnerable state to realize, hey, it's okay to not be okay. And you all as providers, it's important, as well as myself and Miss Natasha, that we recognize these things and help link and coordinate people to these resources, because everybody doesn't know how to navigate in the system and understand how to get connected to these supports. So it's important that, you know, that's why it's great that Kim, you're back in school. Chelsea, it's great that you have the understanding and the certification, and Nurse Haskins, that we understand what's out here to serve the holistic part of somebody. You know, the true integrative care model is now coming to pass. So great job, ladies. Again, keep fighting that great fight.
I think also it's important to look at too. We were forced by being in quarantine, being in the home. We were forced to confront mental health because like everything stopped. The doors were shut. You couldn't send your child to the daycare, and you were confronted with issues that other people have been dealing, even with your own spouses, even with yourself. You know, you're in the house, and then they start realizing, you know what, you're not at work, you're not going anywhere. There's something really going on here. And so now, in order to stay together or stay in that house, you're thinking to yourself, something got to happen. We need some help. And so I think that the pandemic has really helped to allow us to accept mental health and get the help that's needed. And it's not so much, and now everything is virtual. And so I think it's easier now for people to be able to do it at home. I don't have to go to the office. People know my business. It's just been an easier way for us to just introduce mental health to a lot of people that were just, you know, had that stigma going and would not do it. But I think that, you know, that pandemic has helped. You see it on the news all the time about mental health. Everybody's into it and involved in it. But I want to say this, just listening at everybody's stories, and, you know, me personally, just listening at it, I want to say thank you. I'm going to say it now, because listening to the stories that you guys do, it takes a special person to do that. And I'm sure that there's some people that is viewing right now, because I'm going to tell you, if I had to touch that iPad, I probably would have just left. If I had to deal with, you know, I got kids at home, I got a family at home, and I'm having to check in people that are mentally ill, or I'm having to see patients constantly in a medical setting, and they probably have COVID. I don't know. I probably wouldn't. I'm just not, I don't know if I'm built for something like that. And so thank you, ladies, for sticking it out these 11, 10, however many, I don't even know how long it's been no more. It seemed like, Lord Jesus. And so, but thank you. I gotta say that first. And before we go any further, I just want to say thank you guys for just sticking it out and still providing that care and support. And, you know, I know that it's definitely a challenging thing, and it's not over. It's definitely not over. So, but I do want to ask this question though, and I know it's kind of in relationship to, you know, your connections with mental health, and I hear what's going on, but how have you personally been impacted just by the pandemic? And I'm asking that just because of what you're doing and how you're doing it. And, you know, I just really want, we want to know, because nurses, y'all are like super women. We don't even look at you guys as being human. To be honest, you know, it's like call a nurse, you know.
Right.
So I'm being honest. I'm not a nurse. I can tell on everybody. So let me start with let's start with Kim. Kim, tell us what you got. What you got? How you been dealing with the pandemic?
I actually I did therapy. That was very helpful. I do a lot of prayer. I have a very supportive family. I have a lot of friends I talk to. It was really rough at first. As long as I've been in healthcare, I've never experienced anything like this. And so when I felt like my anxiety was going up, I sought therapy, and I loved it. I enjoyed it. And I always recommend it for people. So I did that for a while. Basically learn some different coping mechanisms, because basically that's what I needed. I was allowing my anxiety to get the best of me, and you know, things are out of your control. You have to find ways to cope. So I knew that I wasn't going to change careers. I knew that this is what I loved and this is what I was going to keep doing, but I needed to find a way to make sure that I was healthy mentally so that I can continue to provide good care. Also, I have a son, and so I didn't want to fall apart in front of him, and I wanted to continue to educate him and my family and my friends, and not fall apart. So I did therapy, going to the gym, prayer, communicating with people, talking to my coworkers, and really just doing as much research as I could, continuing to stay on top of everything so that, if anybody asked me any questions, I would be able to help them. And if I didn't know the answer, hey, this is where you can go look, or I'll get back with you on that. So I felt like we're all in this together.
Kim, out of curiosity, was your therapy, was it face-to-face or you did telehealth?
It was virtual. It was virtual, and I have a lot of friends who are therapists, and I wanted to know, what do I look for? Should the person be my age? Should they have, how many years of schooling should they have? And so I got some tips from some different people, and thankfully the first person that I chose, the relationship worked out. Everybody doesn't always work out that first time. That's okay. If you have to, if you don't have a good feeling or something like that, it's okay to seek another therapist. That person is working for you. They're not going to tell you what to do. You're going to work together to come up with a plan to help you get through whatever you're going for. So, I also want to say, you don't have to have a problem to go to therapy. You can get therapy at any time about anything, and it's okay. For so long, our culture, we have just been told that, oh, you don't need therapy, pray about it, go talk to the pastor, talk to your grandma. All those things are okay, but it's okay to seek professional help. And we have to normalize that so that people won't be embarrassed by it. I've never been diagnosed with anything, but I still had a therapist, and that's okay. You can't talk to your family, your friends about everything. So it's okay. And one thing the pandemic made me do was think about the need in the community, especially since the pandemic, for mental health workers. And so I'm currently attending school to get my postmaster's to become certified as a nurse practitioner in mental health. I'm already a family nurse practitioner, and I can, evaluate and treat some of the milder cases of things, but I wanted to be able to do more. So I'm going to add that to my skill set so that I can be another resource for the community.
Awesome.
That's awesome. That's so needed. I mean, it really is. I really think so. And that therapy, thank you for being transparent, knowing in your position that, it's okay. And I think that every time a person of stature it reveals that, it helps someone else to accept the fact that, I can do this too. And so I think that, one person at a time, and our transparency is always a good way. And I agree, the pastor is good to talk to, but understand that pastors, unless they have a special training in mental health, the prayer is going to take you to a certain place. The faith is going to take you to a certain place. But we also need to understand that if we're going to go to the doctor for everything else, it's okay to talk to a therapist for some things that's going on with the mind. So just a tad bit to put in there. So I'm going to ask, let's see, Elise, how you been affected by the pandemic? How's it going? How's it going? You traveling everywhere, so I see you flying. So
You know what? I think that it's made me more hypervigilant, and that's just total honesty as an individual. I have to remove my title. I'm a human being, and I'm just as scared as everybody else. And I think that people look at us as healthcare providers and feel like we shouldn't fear. No, I'm just as afraid as you are.
Yep.
I have the same fear that you do, and because of that, I have overly educated myself as well as built up my immunity system. So I get a lot of questions, and I try not to do, from my patients, what would you do, doc? What would you do? And I'm like, hey, hold on. So I think for me, it just made me more hypervigilant because I've learned that I need to build up my immunity. I know that the COVID is a virus, right? So I've learned that, I need to be more healthcare diligent as far as my own health is concerned before I can educate or protect the community, I need to protect myself. Because I am, even like my dad, like it's bothered me because I've never gone this long without seeing my dad. My dad lives in New Jersey. So I've been away from him. So it's affected me, right? So I've called him more and I've checked on him more. I just called my brother today and I'm like, just check on daddy. Like I can't, I just left another place where I was exposed to COVID. I don't want to come around him. So it's made me kind of feel isolated. A bit with my family because I don't want to be that person that subjects my family to the virus. Do I have COVID? No, but I don't know. And I don't want to be that person who has to live with the guilt of subjecting my family to it. So I'm hyper vigilant. I'm extra careful. So mentally it's taking a toll on me, but because of my faith, and I'll tell every healthcare provider that I don't project my faith on my patients, but if they ask me, I'm there. But as far as me, I've been in therapy before, so I know how to deal with coping mechanisms and dealing with anxiety and things like that. So I've learned coping mechanisms, how to deal with, things that surface. I've learned how to do those things, but it's caused me to feel isolated from my loved ones in a sense, which is a little challenging. Even now, my family's like, "Are you back in town? I'm going to come over." I'm like, "No, don't come over here. Let me get COVID tested first." Yeah. And it's just to protect them. It's to protect them. And it's because I have a sense of responsibility for myself, but as well as those around me. So for me, I would just say it's made me to, kind of feel like, I signed up for this. And how people say, "Oh, you signed up for it, it's your job." No, it's not my job. It's my purpose. So I'm very, very careful to use that. It's not my job. It's my purpose. It's what my life has been purposed for. I love what I do. I don't apologize for doing it, but I do know how. Like I've been taking 24-hour immune booster. I take my elderberry gummy bears, things I've never done before. It's like I'm taking things to boost my immune system. I'm washing my hands. My hand sanitizer is right here. So, just more hyper vigilant to staying safe and protecting those around me. But it can be a lonely walk sometimes, especially when you have family that you're used to being around. So just, doing the best I can to continue to take care of people and keep them safe too.
And I appreciate you saying that because, like, when you said that you're just as scared as everybody else, that's like, wow, because, we honestly, those that are in the healthcare field, we're looking at you guys and you guys have on the suits, the mask with the shield and everything, gloves. And we're like, how'd they get it? And it's like, we forget about the fact that you guys are people too. And a lot of times because we see that and we see all the PPE, PP something. We see all of that. So we just think y'all just free and clear, not going to get it, but you guys are impacted just as much and even the more because I just don't think they know everything about this vaccine and virus and strands. And I'm not even going to go into that. I'm going to leave that alone. But yes, thank you for that. Chelsea, come on. Because we getting ready to go in after this right here. I'm going and y'all already know that's why we on here tonight. But we're gonna go ahead. Tell me how you been impacted, Chelsea.
My anxiety level has definitely been through the roof. And I've been having conversations down to my 13-year-old where we have been meditating. He has told me things about how to meditate and so when I go to work now at my part-time job, like I clean as soon as I get in the building. So they already know Chelsea is not doing anything before she wipes down everything. She sweeps the floor. She wipes down the computers. I'm all out in the waiting room, cleaning up, wiping down the chairs and everything for the patients coming in. I'm in all the triage rooms, consult room. I'm just wiping down everything because I'm like, my patients are coming in. I don't know if they have been exposed because we have a lot of patients coming straight off the street. And so, I have a mask and a shield on. And that's pretty much it that I have to protect myself. I do try to wear 2 masks and with my eye shields, but other than that, that's all that I have. I'm not on the ICU side of it, and I don't have all the PPE that those nurses have to put on with all the layers. So, my exposure to me is just like if I'm walking outside or if I'm at the grocery store. That's how I feel like my exposure is. And so my anxiety has been through the roof, and I've been trying to, figure out, okay, what can you do to calm yourself down? So, now I'm praying more when I go to bed at night. I'm praying not just for my family, I'm praying for everybody, like, because COVID, the death toll is too high. And in order for us to get out of this pandemic, we all have to do our part in wearing masks, hand hygiene, cough hygiene, because people still coughing. And they're not covering their mouth, they're not, washing their hands. And so my background also is infection control. So when I see this, I'm like, oh God, it's driving me crazy. So
it ain't no more God bless you when you sleep. People be like,
right. Right. So it's just like, I need you to cover your face up, like, for real. And even if in my full-time job, I sit at a cubicle, in a little area, and we have to sit with our shield and our mask on. And at first I was like, oh my God, this is ridiculous. Like, I don't have anybody behind me. We got spaces between us that separate me and my coworker. And it's just like, why are we having to sit here with these goggles and masks on? But then we get a scare in the office and has been exposed. So it's just like, okay, Chelsea, this is why we have to do what we're doing, because it doesn't matter. It doesn't have any race, creed, color, nationality, or anything. Everybody is, if you didn't have it last year, if it's still going on, 9 times out of 10, you're going to be exposed to it. How are you going to deal with it? Pretty much.
and
Well, look, I got a question. And I'm gonna let you go after that, Vic. But I'm gonna ask this. Now, I don't know about. I'm gonna ask this for me in America. About 20 minutes after I got that mask on, I started getting side effects. Now, how y'all got two on? It might not be side effects, but y'all know my nose started running. Next thing I've been good all day long. I put that mask on 30 minutes tops. I'm sneezing. People looking at me like I got COVID. One day I was in Walmart. I'm gonna tell y'all this, and then we're gonna move on because I know. I was in Walmart, right, and I had the mask. I started sneezing, right, and it got bad. I did the 3 sneezes.
you don't Walmart, y'all. She stay in Walmart.
What you do too. So I sneezed 3 times back to back.
I double mask.
You was with me. You was with me. But so I sneezed 3 times, and the 3 times sneeze, people ready to kick you out the store. They looking at you. So I made an announcement. I said, "Hold on, y'all. I do not have COVID." I said, "Stop! Don't look at me like that. I ain't got it." I said, "This is allergic allergies."
It got quiet in there, y'all. We were at the checkout line. It got quiet. We all looked. And I'm like, you about to be by yourself.
She's looking at me like she didn't even know me, but it's okay. It's all right. I would have done her the same way. But so how do you guys keep the mask on all day like that? I mean, do y'all take breaks? Because people are struggling right now. Like I had to go outside for air one day. It's just
so. Let it marinate on the question about the mask, because inquiring minds, they want to find out about this vaccine. But I want to bring something up first, real quick.
Okay, go ahead.
I want to thank Kim again for being with us tonight. Because Kim, do you mind sharing your recent situation?
I was sharing with Vicki several days ago that I actually am recovering from COVID. I literally just got off of my quarantine. So I did contract COVID, and it has been an experience.
And just like you're saying that, yes, because when Kim and I connected about the show, she was like, "Honey, I'm on day 9 of this COVID." I said, "What?" And, I just instantly prayed for her right then. And I said, well, let me know. We'll monitor and see how you feeling come Monday. But, like you all said, y'all are nurses. So people automatically think, well, the nurses didn't have COVID. That's just the automatic thought because, like you said, we think y'all superheroes. Y'all got your shield. You know how to do the hand hygiene, all this stuff. But like Kim is being transparent and saying, I contracted it, and I know Kim was careful because she was talking about being careful the last time we had the gravity talks. You know,
Yeah,
but it's
you know, I actually got it from a close contact, someone that's in my circle was exposed, and me being around this person, because I know this person, you know, they don't go anywhere, they're very careful, and so that person contracted it, and I got it from that person. And it's you know, thankfully I did not have the respiratory aspect of it. I didn't have any shortness of breath, I didn't have any cough, but the fatigue, you know, I've had the flu before. The fatigue, it was unbearable. You know, there were times where I thought I would die. I was very weak. It was times I crawled to the bathroom. It was times where I thought I would pass out in the shower. And the anxiety was at an all-time high because my son was here. And all I could think about was, you know, Lord, just don't let me pass out or don't let me die. And my son has to find me. But the isolation, the mental stress, it was a lot. And I'm telling you, without a good village, people praying for you, you knowing, you know, I think I'm gonna be okay. Your body doesn't feel like that, but I had to do a lot of self-talking, but it truly was the village that got me through, because I'm laying there every day, barely able to lift my head sometimes, not knowing if I'm going to use the bathroom on myself, stomach. I had the GI aspect of it too, vomiting and diarrhea, and I was so weak. And all my prayer was, if it's my time, don't let my son have to, you know, not be able to wake me up, or also don't let my son contract it. And so we're waiting on his test now. He has asthma, and so he had a cough, and he still has a little cough, but it's not bad. And we really did a good job with staying apart. We had our mask on, Lysol, Clorox wipes, lots of prayer, lots of thank God for my parents. You know, they made me video with them every day. I have another friend that works with COVID patients, Takesha. I text her all day, every day. Some of my friends called and I would bust out crying. It's been a lot. So it has certainly changed my perspective on COVID. Not that I wasn't diligent about being safe, but I really have stepped up my research on the vaccine and different things like that. And you know, I'm having some different conversations. I actually cannot get the vaccine right now. From my understanding, I have to wait about 90 days. But it definitely was an experience, and I can't even stress how tired I was during that time. And I'm still not 100%. I'm probably about 95%. So I'll be able to tell people, hey, I've had that. You don't want that. You know, and I did everything. I still do, you know, I did I call them shots, the turmeric, the ginger, the hot teas, you know, the vitamin D, the aspirin. I've done all that stuff, and I still contracted it. And I'm just thankful that, you know, I didn't have to go to the hospital, or I didn't lose my life, or I wasn't sicker than I had been. So I'm still on the end.
Praise God. And thank you for sharing, Kim. And I'm so glad you look great. I'm so glad you're on the other side coming out of this thing. So thank you for sharing. Thank you for sharing. And that brings us to the question about the vaccine. You know, Nurse Haskins, you know, let's talk straight up, because especially the brown community, you know, when we think back to the Tuskegee Airmen, you know, when they experimented on us with the syphilis projects and things like that, people are really skeptical about these vaccines. Everybody like, let the first wave of people get it, we see what happened to them, then maybe I get it. And it's like, you know, it's kind of like what Kim just shared. Do you want it? You know, you got a higher chance of contracting COVID, regardless of how careful you can be. and this is what can happen. These are the symptoms you may experience versus the after effects or side effects that you may get from taking the vaccine. So that's the question. Everybody want to know tonight, to take the vaccine or not take the vaccine. That is the question, and why.
That question is for me.
Yes, ma'am. We're gonna start with you.
Oh boy. All right. So as far as the vaccine is concerned, I would, you know, as a healthcare provider, and I'm quite sure that Kim and Chelsea can attest to this, we're not supposed to tell people what to do. We're supposed to tell people to make educated decisions for themselves. We're supposed to give people the research on the vaccination and tell them to research it for themselves. Look at their comorbidities, look at their risk factors, look at everything. Now, what I will say is if someone asks me, did you get it? I can answer that question. But as a healthcare provider, we're not supposed to directly inform a patient on what to do. We're not supposed to do that. So I'm going to be treading lightly with that.
Because we're not your patients. So what would you
Listen,
What you gonna do? What you gonna do then?
what you gonna do? You already had the vaccine. You said you had the vaccine.
no, I didn't.
Oh.
I said I'm going to get the vaccination. I have researched. I have researched and I have looked at my risks versus my benefits of receiving a vaccination. I've looked at the side effects. And I'm one of those people. I'm not gonna lie. I'm one of those people who sat back and wait for Chelsea to get it first. I want to see what's gonna happen to her first. Let me see if she grow an extra arm or something. Chelsea, let me see what's going on with you. Let me see if you lost your toenails at midnight. Girl, call me, let me know what happened. Like, I'm one of those people. I'm just being honest, you know, and that's the thing about healthcare, right? And I think, Kim, you said it, like, we have to be transparent. We have to let people know that we're human, right? So I have to be honest and tell people, no, I'm not going to be the first one lining up for nothing. I think I almost missed the flu shot cut off at UNC. I almost got fired. I was like, hold up, y'all go first. I've been that person all my life. Chelsea know me. You go first. I'm wait right here till you get back. Let me see if you crawl back or walk back.
I hold your pocketbook.
I want to see if you crawl back or walk back. Listen, I want to see first. But after doing research and after looking at the line of work that I do and after looking at the risk versus the benefits and my own health, I'm someone who recently had a major surgery in September. I don't think it's worth risking my life. And I am actually going to get the vaccination.
You are going to get it.
Which one?
Oh, I'm going to get the old school one, the Moderna,
Right.
the Pfizer. Yeah, I'm gonna get that one. I gotta get the one that's been out the longest. You know, I'm like the Johnson & Johnson kid. I want the one that's been out the longest.
Look, I want the Johnson & Johnson shot because
you know, Johnson been around forever.
Yeah, I'm waiting on Johnson & Johnson.
Don't be coming to tell me about no new pharmaceutical company that just landed in the U.S. No, Chelsea, you go first.
2 more weeks. Johnson & Johnson gonna get approved. I'm going for that one.
Listen,
Chelsea, which one did you get, Chelsea?
I had the Pfizer.
Okay. Did you get your second shot yet?
Yeah, I've had both shots. I received my first shot in December.
She about to tell it.
No, she was giving the whole picture. I already know where that answer was gonna go.
Chelsea.
Okay.
So my anxiety was very high. I won't tell you a lie. I'll be very transparent. I had visual dreams. Tasha waiting for me to say it, but I'm not gonna say it. As far as side effects go, I did not have any side effects other than a sore arm. Even with the second injection, I did not have any side effects besides a sore arm. Now some of my coworkers, they had some flu-like symptoms, but after they went home and slept it off and came back the next day, they felt a lot better. But I haven't had any any negative side effects from having the injection. So, and then like everybody that I work with that's had it, I've been asking, have they had any side effects? So besides one person that I know that I work with, that was the only person that had any minor side effects. So, and they tell you that when you get the injection, what the minor side effects are. And actually, after you receive the injection, you have to wait between 15 minutes to 30 minutes after you have it to see if you have any allergic reactions.
Mhm.
And they ask you a series of questions, including have you had allergic reactions from any vaccines previously. So if you have, then they kind of tell you which direction that you need to go. So, but other than that, I've been fine. I do recommend, based off the research that I have, a lot of people think that we just produced the Pfizer vaccine. The United States have been doing research on this when Obama was in office. So it's not something that just came out. It may just be presented to us, in the community as a nation. But besides that, they have been doing research on Corona before Corona actually came out.
Right.
And through some of the research that I've found and some of the programs like this that I've been on, just kind of listening to other doctors and other researchers and getting my information. Because I'll tell you, I was the first one to say, oh, I'm not getting that injection. Healthcare workers, they want us to be lab rats. Oh no, I don't know about lab rats. Use it on a couple of more rats before you come and try to, inject. I posted it on Facebook. I posted it on Facebook, so I can honestly say that's what I said. And so I was very. What you got to say? I see you.
It's something. It's something about putting the needle in me and then sitting there and watching me for 30 minutes to see what's gonna happen. That right there don't go well. You just sitting there watching. Anything gonna happen? Anything gonna happen? And that's anxiety right there. Just the thought of that.
Yeah.
Am I right? You just sitting there watching me, waiting to see if you gonna fall out. Your arm gonna fall out.
Anything, they're not gonna know how you react to something because you're different than everybody else.
Right. And the thing about
Mm-hmm.
And the thing about it is, because the Black community, because we're skeptical about the vaccine, they don't have a lot of research to know what the side effects are within our community, because they haven't really tested us.
Right.
And so even down to one podcast that I was listening to full of Black doctors, they were saying that, even our children, they don't want the kids, I think it's 16 and under, to have the vaccine, because there's not much research on even the kids. And so, they need more kids you don't want the kid to be a test dummy or anything like that, or exposing them to the unknown. But that's part of research. And so how are we going to know how we're going to be affected if we don't have any samples to, what I'm saying? It kind of go back to the thought of Tuskegee men and things like that. And you have all kind of things in your head, but who's going to be tested? All the White community, they're going to know what the side effects are. They're going to be a lot of them are going to be the ones that get the injection, so they have research saying what the side effects are for them, but we don't have the research in the background to say how it's going to affect the Black community. So in
all essence, somebody got to be the lab rat. Basically.
Yeah, somebody has to be the lab rat, and I hate to say it like that, but somebody has to be tested. So, and we have to.
I think the way they're doing it, again, I think the major problem with the Tuskegee Airmen Project was that they didn't have consent. They weren't transparent with them. They did it without them knowing. Versus, us knowing what the potential side effects could be, like, making a sound decision on whether or not to move forward with the vaccine. That you're right. I mean, research is needed. It's just, again, everybody like, I'm not finna be the sacrificial lamb. Somebody else had to be, that, and then I'll learn from them. But you're right. You know, at some point we got to figure something out. But like I said, I'll probably get the vaccine, but I'm getting Johnson & Johnson vaccine. I'm waiting on
I'm
that.
gonna go to it twice. No, can't do that twice. I got to sit down.
That one hit a quitter. That's what I'm getting.
One shot.
One shot. That's it.
But
you know, the thing about it is, with the vaccine, we may end up having to have it every year, like we have the flu vaccine.
Mm-hmm.
So, you know, what are you going to do then?
Yeah.
For healthcare providers, it may be you can't work until you have the COVID vaccine.
Well,
so
you know, you got the cards out.
Right now, you'll get fired if you don't have your flu vaccine by a certain time. They'll take you off the schedule, you know, unless it's for religious, you know, reasons. What are we going to do if it goes to that?
That's a good point.
Are we going to get the vaccine? What are we going to do?
Be able to travel because they got Council Branch, from what I understand, has a vaccine card that they started issuing. Right now, they give you a paper copy, but they have cards that now they may require you to utilize when you travel and go to certain events and stuff like that to see if you've had the vaccine. So,
but there are people that won't even wear masks still at this point. So
you're gonna still have people that's gonna not wear a mask and people that's still not gonna get the vaccine. You know, that I think we just got to flatten the curve. Everybody will get the flu vaccine.
Right.
So, you know, everybody's not going to get the COVID vaccine, but we got to flatten.
We have a high number of people that die from the flu vaccine.
Wow.
We have a very high number. So people have the stigma about the flu vaccine. Oh, I got sick because I got the flu vaccine. The thing about it is you didn't get sick because of the flu vaccine. You know, your body was introduced to the vaccine. You get sick because your body is building up antibodies. And so we confuse that with, oh, I have the flu. Okay, well, Chelsea, I caught the flu after I got the flu vaccine. Okay, if you had not had the flu vaccine, your symptoms could have been a lot worse.
Yeah.
So the flu vaccine kind of curbside, you know, the symptoms that you could have really had. You could have been in the hospital, but because you protected yourself, your body has a memory of the disease, you know, and so that's why we push getting the flu vaccine. So, you know, medicine is hard, and I get it. Healthcare is hard. I totally get it. The unknown is hard.
Yeah. Yeah. And that's why prayers coupled with that. What were you saying, Kim?
I think it's important that we don't shame anybody who does not get the vaccine. I think what we need to encourage people to do is do their own research, talk to their healthcare team, get as much information as you can. You can go to any website of a pharmaceutical company that's given the vaccine and it can answer a lot of your questions. The CDC has a wealth of information. Your primary physician, sit down and talk with their primary physician, ask questions. You know, I always tell people anytime we want to go somewhere or do something, we do whatever we need to do that. So we need to make our health a priority. We need to educate ourselves. Don't ask your friend, are you getting it? I'm gonna get it. Find out for yourself. Everybody has a different body type. Some people have chronic diseases. Some people have other conditions. They may be more sensitive. Do your own research, and it's your business. You don't have to tell anybody if you got the vaccine or not. It's your business, but do your research, and that way you can make a sound decision about it. We do have a lot of people that have died from COVID. One of my concerns is that the African American community is not going to get the vaccine, so that's going to keep us in that high number of deaths and people who are contracting it. Now, in saying that, what I'm saying is do your research, decide with your healthcare team, is this going to be the best thing for you? Don't just listen to people say, get the vaccine, you don't want COVID, you're going to die. Do your research. Find out why you should pick this over that. Vicki, you mentioned getting the vaccine that's only one shot. My parents, they're the same way. They want to wait. You know, they just want to get one shot. I think that's a legitimate concern. You know, I've had COVID, so now I'm having anxiety about possibly getting the vaccine and having to go through maybe some mild symptoms again. You know, those are very valid concerns. So what I say is do your research, talk to your doctor, sit down, ask as many questions as you want. Go to these websites of the producer of the vaccine, do your research and decide, you know, hey, this is going to benefit me, or I'm still having some questions. That's okay. Just get as much information as you can. Don't just watch the news, or don't feel bullied, and don't allow anybody to shame you if you decide that you don't want to get it. We all take risks. I mean, everybody's not going to get it. Everybody's not going to get it. So do your own research, and that way you can make up your own mind about the vaccine.
That's a good point, a great point. But you know what's interesting too, and again, y'all are providers, y'all in the healthcare field. You know, like you said, it's important for us to do our research, but we go out and we eat fast food at any given time. And we already know that is not the best thing for us. We drink certain drinks that are not good for us, that, you know, can mess up your intestines and things like that. And because we don't do the research, we just assume, oh, it's being sold, it's okay to eat, it's okay to feed it to our kids. And so when it comes to other things like this vaccine, I think I'm gonna bounce back to the media. I think the media has a lot to play in all of this. I think if the media really put a push on, you know, to get the vaccine, it's safe, is this and that, then more people may be prone to getting it, because we lean towards, okay, if the media is saying it must be true. We don't do our own research, we should. So again, media, and like I said, when you bounce back to the fast food stuff, the commercials, like it's all in the media. It's all, you start seeing commercials about the vaccine, somebody getting a shot and leaving out smiling, happy. Then eventually that's gonna resonate. We're gonna be like, oh, okay, it's okay to get the vaccine. So eventually the media is gonna have a big campaign out here, and because these pharmaceuticals want this money.
Right.
So, yeah, I said it, and they hope they don't. We cool though, we cool, pharmaceuticals. But yeah, I mean, that's just my 2 cents.
I think you're right, because I have to stop. I have to start watching the news some days. I just have to take a break, because I became a reporter.
Yeah.
I said, whoa, it's crazy out here. Let me tell y'all.
Y'all in a staff meeting, y'all, and she'll say, you know, the numbers are so and so. I'm like, trying to want to know the numbers today.
No, because people need to know what's going on out here. And then you go into places. I've left out of public places because I see somebody in there that's just disrespectful and not having on a mask. And, you know, it's like, just because everybody else has on one doesn't mean you don't need to have on one. We don't know. Honestly, I'm going to tell you, I really just don't think they know everything about this virus still.
They don't.
Well, now we got all it. Now don't y'all now I'm gonna say this because America want to hear this, but don't y'all think it's strange how all of a sudden they came up with a vaccine, then a week after the vaccine got here, then here come another strain, and I'm like, so what? What we're gonna do now? What we're gonna do now? I mean, because it's like, is that gonna work on the? And then now it's a booster shot that you can get. You know that, right? Did y'all hear about the booster shot?
No, what channel was that?
I ain't watching the news. You got to
on the main channel, mainstream media.
They got to do their research. That's what they yesterday. Moderna is making a booster shot. See, somebody on here that's watching right now, they know what I'm talking about. They give me an amen if you're watching. But they're giving a booster shot to go along with the vaccine for the new strand of. Don't look at me like that. I'm telling you, this. I'm not making this up. Y'all Google this when you get on.
They said the vaccine can handle the new strains.
Moderna's making the booster shot to give you to help with that specific new strand that they have. I don't know if everybody else is gonna do it, but I'm like, oh boy, now it's something else we got to get.
So they say the Pfizer vaccine covers the new strand, and because the Pfizer, you actually have 2 vaccines, and so you know, it's supposed to cover the new virus. So with Moderna, you're only getting one shot. So that's that one hit quitter. One.
Moderna, I thought Moderna was still 2 shots. It's just you don't have to.
Moderna was still 2, and then Johnson & Johnson is the one hit acquittal. That's what that was.
So the Pfizer is the one I'm most knowledgeable about. So I hadn't done much research on the Moderna because I know my job they were pushing the Pfizer vaccine, and so that was kind of what I was focusing on. Just because I was getting it and I wanted to know what the side effects and everything were. So.
But then there's one more thing, and I'm going to close out. I'm closing out. No. Because now, see, y'all don't watch the news. I see that now. Y'all research.
I have to balance.
No, because see, America, this is what everybody want to talk about anyway. But America, let me tell you something. They running out of stuff. They don't have enough. That Duke said they needed more vaccines coming in. And so I'm like, what in the world? You know, what are we going to do?
They got vaccines sitting on the shelf. The news also saying how people ain't getting the shots. They're not getting vaccines to the people.
Right. But then y'all keep listening. But that's what I'm saying. I just wanted to bring that up. That's all. But at this time, we're getting ready to do something called Full Circle. So everybody, once again, I thank you all for this has been a mixture. This has been a mixture and a combination of sharing tonight. And I say that because, you know, there were tearful moments. There have been, you know, very transparent moments. And then there's just been, you know, just those moments where, you know, you guys have just really shared with us your experiences. And for that, we definitely and genuinely thank you. You know, and we've had a variety of panelists on tonight. Kim is just getting out of quarantine from getting through COVID. Chelsea was took the vaccine, and bless her heart, she's still here. So and then we have Elise and Nurse Haskins, and she was right there watching someone leave the world, and their daughter right there on an iPad. And so, you know, just to have that variety of experiences with COVID, I think that you guys have shared a wealth of knowledge with us tonight. And I think one of the takeaways tonight is just do your own research. And I love that. So tonight, our full circle is the opportunity and the time for us to leave our closing statements and our closing remarks. And so tonight, our topic has been about the vaccine. Should I take it or should I not take it? And I know that you guys as healthcare providers and professionals that you can't tell people what to do. But I would like for you to just kind of give us just some words of advice and words of wisdom as it relates to the vaccine, and even also based on your experiences as it relates to us taking care of ourselves. So just a couple of minutes just to share, just to be as open and honest about it, however you want to be. Usually I try to take you in a certain avenue, but I think you guys just share, and you guys are so excellent at helping us tonight, because honestly, I'm going to tell you, y'all helped me, because I was on the other side, but I'm getting closer now. I'm getting closer. So thank you for that. But I'll start with Chelsea tonight. You have some closing remarks for us.
Yeah, I just, like Kim said, just with the vaccine and COVID, just do your research. Just making sure you're staying hydrated, working on your mental, however that may be for you, whether it's meditation, it's spiritual, it's you having a conversation with a friend, but learning how some way to relieve your stress. It's not always found in a pill. And people sometimes think a pill fixes everything, but sometimes just talk therapy can help you get through a lot of things. Just making sure, you know, whatever recommendations your provider gives to you, because your provider, if you have a relationship with your provider, then your provider should know all your risk factors. And then just knowing, after talking with your provider, just making that educated guess, or I won't say guess, educated decision in determining, you know, the risk, the pros versus the cons when it comes to the vaccine. And just overall, just please wear your mask and wash your hands. and stay 6 feet apart. You know, they don't know, you know, every day something changes, but one thing that has been permanent is us wearing that mask, us staying 6 feet apart, and, you know, and us washing our hands. So just continue to do that. And, you know, and I know it's hard, but staying away from family as much as possible, or people that you don't live with. No gatherings, you know, if you're having gatherings, just making sure everybody has a mask on, because even in the gatherings, you know, people think because we're family, I shouldn't wear my mask. But I don't know who you've been exposed to when you go to work, just like you don't know who I've been exposed to. So, you know, you may feel like you're a low risk factor, but in all reality, you know, it's a risk there whether you see it or not. So that's just my takeaway from the whole COVID vaccine 2021. So we just got to figure out how we're going to, you know, live through this. And we made it through 2020. Those that did made it, you know. So now we got to figure out how we're going to get through 2021 and with this virus. So
Awesome. Thank you. Thank you so much, Chelsea. Kim.
Chelsea said everything that she said. Oh, okay. I wanted to really stress that in addition to what Chelsea has said, we need to get back to basic self-care. That means that if you are paying insurance through your job, go to the doctor, do your preventative care. Let's try to do some exercise. I love to eat too, but I'm trying to have a healthier lifestyle. That is your best chance to fight this. The more chronic conditions you have that are not managed properly, it puts you at a greater risk of succumbing to COVID. So let's get back to walking. One good thing that COVID has helped, we've gotten to spend more time with our families. We have birthed businesses from the COVID. Mm-hmm. We have, you know, mended fences with family and friends. We are realizing more and more that life is short. So mm-hmm. let's get back in the kitchen and cook. Let's make more salads. Let's eat better. I'm doing the best I can. It's a struggle every day. So that is our best chance of fighting this, is our preventative health, our care, getting our exercise, and education. Educate yourself. Don't ask anybody. You find out for yourself. You look it up. You call your doctor. We work for you as a provider. You write your questions down. Do a virtual visit. Ask questions. See your therapist. Read. Journal. Do whatever you need to do to keep yourself sane. And be careful. Be safe. You know, wear your mask. Wash your hands. Anything like that. So I think self-care, we have to be more diligent about that. We do not want to pass this to our newborn babies and our grandparents. We don't want to instill fear in people about the vaccine. We also don't want to instill fear in people about COVID. So that's why it's important. Find out for yourself. Get off of social media. Don't believe the hype. Public enemy. Don't believe the hype. Do your own research. So, and take care of yourself. So I truly believe that I'm not the healthiest person. I need to shed some pounds, but I don't have any chronic conditions. That could be why I probably did better than someone else. You know, I have a history of asthma. I didn't have any shortness of breath or coughing. Everybody's symptoms are going to be different, but I don't want anybody to get this. So let's get healthier. If you want to take the vaccine, you've done your research, you feel good about it, get the vaccine. If you're still undecided because you have questions, ask questions. Those of you that know me, I'll answer as much as I can, but I'm researching right along with you. So don't be bullied into getting it or not getting it. Do your own research and take care of your mental health. It's very important. We need you. We need you. We need each other. So right. That's my takeaway.
Thank you so much, ladies. Woo! That was y'all just made me feel like I could do anything. I'm gonna tell y'all that was very heartfelt, and I really appreciate you just sharing that. And now you're right, Kim. We need you. We need everybody. We need everybody alive and well. And so thank you. Vicki?
Yeah, again, ladies, thank you for joining us tonight. I know Nurse Elise looks like she had to break away. But you know, y'all are definitely essential workers. But aside from being essential workers, you are essential people. And we all are, like Kim said, we all need each other. We're gonna get through this together. But you know, I think research is important, but prayer and faith is also very important as well. Because in that midnight hour, like, you know, Kim shared about when she couldn't even walk to the bathroom. I know that was scary, but I know she probably only had Jesus that she could really lean on. And so he is faithful. And you know, I think that even though we have lost a lot of lives to COVID and to other things as well, we forget about other things that people are in this world. It's not just COVID, but you know, just prayer will just kind of hopefully help us get through. It is scary. We don't know much. The media don't know. The science don't know. Nobody knows, and I think that's what is so very fearful because of the unknown. But God didn't give us a spirit of fear, and we have to just continue to walk by faith. So I think at the end of the day, just keep doing what you do. Be safe as best you can. Do the best you can. You know, still live. You know, I know certain things we can't do, but do it responsibly. And, you know, because that's part of your self-care. You can't be cooped up in the house. It isn't good for your mental health. I'm just going to be real. That's my take on it. Now, I ain't saying go out here and be out in the streets all the time, but you have to do some of the things that you used to do to give you that sense of normalcy. But just be safe in doing it as you can. Now they're talking about double masks. I've been wearing double masks.
Me too.
Double mask up. You know, some places, especially that are more crowded than others, you know, just be aware of your surroundings. But I like what Kim said. Don't shame nobody if they ain't trying to do it. If they ain't trying to wear a mask, I don't shame them. I just have mine on. And then I know not to take mine off and you know, I'm in their company and they ain't been wearing no mask the whole time. You know, so just continue to be safe out there, y'all. It's been great. Thank you guys for joining us tonight. It's been our first show for 2021. I missed Gravity Talks. I must admit, I missed hosting with Natasha with her crazy self. But she's the best co-host around, and I'm truly blessed. This is an outlet for us. It gives us an opportunity to share our thoughts and get things out into the community. And thank you for all y'all support. Kim, again, welcome back on the show. Thank you for always being there and being available. I know your schedule is lit, just like I know Chelsea's is and Lisa's. But thank you all for committing to time and being professional about this thing with us tonight to get the word out and to help, again, not just to stigmatize mental health, but destigmatize this corona situation, this vaccine. So thank you, ladies.
You're welcome. Thank you.
Yes, thank y'all. I think y'all to help me. Somebody just put up a second ago that we had a comment. She said it was so informative that she's now ready to take it. She said, Miss Jessie Kearney Boyd said, thank you. I heard it all and I feel comfortable getting the vaccine.
Yes, sir.
And I will say that this conversation has been very soothing and also very frightening. If I might just tell the truth, Kim, to hear your story, I was like, Lord, I'm gonna get that vaccine tomorrow if they let me. And that's just listening. I'm like, Lord, she crawling in the floor, and it was just a lot, and it's scary. And you know, when you've had family members that have experienced it, it's a lot. It's scary because you just never know. And again, probably the news, probably not a good level of support or thinking about any of this. However, I will say this, and in my closing, that there are people that can't take the vaccine. They don't even have an option. They don't have that choice because of certain different things. There are people that have difficulties and they're unable to wear a face mask. And so, I just think that, we all should be diligent and loving each other and supporting each other enough to make the right decisions as it relates to taking care of our brothers, our sisters, our fellow mankind, just so that we can make sure that we can get this thing under wraps. I know everybody's tired. I know everybody's ready to go, ready to get things back to normal. But I'm gonna tell you, I think we're gonna be at this for a little while, and we're gonna be there because everybody's still making choices and decisions. And well, y'all know, the holiday comes and we got to get together. I think this is the longest I have been without going to a cookout or a family gathering, the longest. And just by the grace of God, I don't know if any of you can recall, but look like at the end, right before the pandemic and the year before, everybody was just doing little things, getting together and making sure you get that last trip in, not knowing that this was what we were facing, not knowing where we were going to be right now. So I think that if we come together and we work together, we can get things a little bit better than what they are right now. So again, nurses, let me tell y'all something. This was so good. I think we can go deeper because I know it's going to be something else later on. So I think we're going to do this topic a little bit later on as we get down the road a little bit, because they promised us that April is going to look better. They said April should be looking better and we should be able to see the signs of, the outcome of the vaccine and what it's going to do. And I researched, that's what I got from that. But they did say that. So I'm thinking that we probably need to get back together and kind of see where we are, see how y'all doing, make sure everything's good with Chelsea 2 months after the vaccine. We'll watch her and see if she's good. And I think it'll be fun. What do you guys think? Yes, no, maybe, possibly?
I think that's a good idea.
Awesome. I had so much fun. Did y'all have fun tonight? I had fun tonight.
Yes,
I did. So listen, guys, we want to thank everybody. We want to thank all of our supporters. We want to thank everybody that's checked it out and viewed it. And listen, if you're tuned in right now and you have a family member and they've been talking negatively about the vaccine wearing masks, I think this is a good opportunity to share this particular segment with them and just send it to them and let them watch it, because there was some good information on here and opened up my mind and my thought process so that I can learn a little bit more about what's going on. But in my closing tonight, again, thank you. All the sponsors that supported us. We're going to be moving forward for 2021. So far in the beginning of the year, we're coming on once a month, guys, just once a month. I know y'all miss us, but we're going to get y'all once a month for a little while till it warm up, and then we'll change it up a little bit. But our next Gravity Talks is going to be February the 15th, and the topic is going to be mental health and love. We're going to talk about love. That's what it's going to be. It's going to be about love. The day after Valentine's Day, are you still in love or did you break up? I don't know. We're going to talk about it. Y'all already know. Ain't no telling what I might say. Ain't no telling. But I know
ain't no telling.
I know.
Me.
And by the way, before we get off of here, there were some questions that y'all weren't allowed to answer. So I'm gonna have them at the top of the list for next time about the mask. And you remember I asked those questions and we just went over them. So I'm still gonna ask them questions for the record. But until then, guys, listen, at 8:30, we're getting ready to do a after talk. I got another nurse that's coming on and she's getting ready to give us her input and her spiel about the conversation that we had right now.
Maybe 9 o'clock.
Maybe 9 o'clock. Okay, well, we're going to do it at 9 o'clock. But again, ladies, thank you. America, thank you. And you all stay safe and be safe and have an awesome night, and wear your mask and wash your hands.
And wear your mask and pray. Good night, everyone. Thank you for joining us.
Bye. Thank you. God bless.